conference today is real evidence of the importance of patient groups in the submissions process for new medicines in Scotland. The range of people here, from very small charities through to organisations like mine and bigger, who really want to play a role in the new submissions process for drugs, and it's great that the SMC have provided this day so we can properly engage.
So far I've found it really quite stimulating. I think you've actually managed to get a good sense of some of the developments that have happened within SMC over the last year. A really good sense of how you're connecting with patients, with patient groups.
I think one of the things that I found most thought-provoking was a workshop I've just been to, where we were talking about health economics and some of these really difficult decisions that go on behind deciding which drugs will be funded and which groups of patients will benefit. And we had this little exercise where we had to choose between three groups of patients with different health economic arguments about whether these treatments should be funded. And it really was the most difficult decision to try and decide how on earth do you decide between these groups. So very, very thought-provoking indeed.
There's no doubt the changes we've seen in the SMC have opened up the process massively, both to public understanding and for the opportunity to patients to play a real role in the approval of new medicines in Scotland. I've been to SMC meetings myself as a result of them opening them up, and it's been fantastic to see the process in action. And even though not all the decisions have been ones we would have supported, to have that insight and to understand the difficult situation that decision makers are put in about the approval of new medicines has been really enlightening. And I think the role that PACE has played has been invaluable too.
I think the changes have really shown a commitment towards moving to a new style of decision making around access to treatments.
I think the most important commitment that SMC has made is to invest in their team to help patient groups make submissions. So the role that Jennifer and James have played in terms of proactively engaging with patients groups has been absolutely invaluable, and having them on hand to give us advice and support in how to make the best and strongest patient group submissions has been invaluable. And I think hearing those submissions played back in the SMC meetings, being able to attend, has been really important too, because it means we know we're playing a role in the process, and we can, as a check and balance that our contributions are being heard. It's been really important.
Well, having sat through the presentations this morning, I think the thing that really struck me was the advice from the public involvement team, which was talk to us, pick up the phone, consult us about your submission. And I think that sort of openness is fantastic. This idea that you can prepare a submission, to have a chat to the team first before you put in, take their advice, and I think that's what I'd advise people to do.
Decision makers about new medicines are presented with loads of economic data evidencing the impact of the drug and the cost of that drug. Patient groups are there to provide the heart of the submission, to relay the impact that new medicines can make on patients' lives, how progression-free survival means that people can spend quality time with their family, with their loved ones, continuing to work and live lives and be part of this country. Now that's what we can bring, and that's what we need to ring true and sing loud every time we attend a meeting and every time one of our submissions is heard at SMC.